Okay. Good evening. The Indian Association of Physiotherapists, IAP, established in 1955, is a non-profit professional body representing physiotherapists at national, international level and is a member of World Physiotherapy. It has over 50,000 members and 300 plus institutes working to promote quality education, professional practice, and public health awareness. The IAP Women Cell provides a dedicated platform for physiotherapy female to engage in academic, clinical, and social activities across India. It functions under National Head Dr. Ruchi Vaishne Ma'am and is organized into 5 zones. IAP Women's Cell Maharashtra is led by State Coordinator Dr. Suvarna Ganveer Ma'am, along with her team, and operates through 18 district committees. The state team has been honored as the best IAP Women's Cell state team multiple times between 2019 and 2024. This interview series is organized by the IAP Women's Cell Mumbai District with the support of the district coordinators. On the occasion of International Women's Day, the IAP Women's Cell Mumbai District Maharashtra is honored to feature an eminent woman, Dr. Lalita Ma'am, for a special interview. She is recognized not only for her professional excellence, but also for the strength, vision, and perseverance that reflect the team spirit of women who continue to elevate and inspire our profession. Dr. Lalita Savardekar ma'am is a scientist F and in charge Reproductive and Bone Health Unit at ICMR National Institute of Research in Reproductive and Child Health, Mumbai. A senior researcher and national authority in women's health, menopause and contraception, and osteoporosis. She has contributed extensively to landmark national and WHO support research, an International Bioethics Fellow, and respected ethics committee leader. Her work has significantly influenced women's health and research governance. Through this interview, we proudly celebrate our journey, leadership, and lasting impact on women working in healthcare. We would warmly welcome you, ma'am.
Thank you so much for your kind words.
Yes.
Mm. Good evening, ma'am. Good evening,
Good
everyone.
evening.
We'll be starting with your first question. What inspired you to step beyond clinic walls and work in the community?
At the outset, I would like to thank your IAP for taking the initiative as to bringing out physiotherapy out in the community. So I'm putting across the same thing that what happened for us was we were working in the area of women's health, and from there we went on to the area of osteoporosis, and we realized that musculoskeletal issues are a major concern among women, and they just go to the general practitioner, get themselves treated, and the root cause for musculoskeletal issues remains unseen. And this was an initiative that we took, that we started off with yoga, and we realized that women need to understand that yoga is not only the union of mind and body, but along with that, when you add on physiotherapy to it, or if you try to inculcate women as to induce physiotherapy as part of their daily living. General exercises in general, we realized that it brought about a big impact in their quality of life, and that was the reason we felt that it should not be within the clinic limits, but should go beyond the clinic limits and into the community. And we have done several integrative research workshops also in the same area. So I felt that women's health has to be targeted not only in the clinic but also in the community.
Good to know, ma'am. Next question. What gaps in community health did you notice that pushed you towards this work?
Women always look at musculoskeletal issues or joint pains or even muscle fatigue as something that they want in terms of medicines. We have tried to bridge this or tried to make women cross the path, telling them that medicines is not the answer for your musculoskeletal health. You need to understand that there are some issues with your muscles and the tendons, and that is the reason you need to inculcate physiotherapy and try to look at it not as a expense, but try to look at it as a long term investment which will help you to ensure that in future you may not have these musculoskeletal health issues. That's the reason we are more focused on for preventive health care. For that we have a small simple exercises for knees, for foot, where we feel that osteoarthritis is one of the major issues, and cervical spondylosis. So we educate women onto doing some of the basic physiotherapies. Now one thing we observed is that community is all flooding towards yoga, but I would like to put up a caution here that yoga is very good unless and until it is done with good supervision and with understanding what the basic problem is. So, without understanding the health issue, if you just go for yoga, you may land up with some more complications. So, I would put up a note of caution that any person who is just healthy, they may go ahead with yoga. But if you have some health issue, you will have to go under supervised guidance, be it a yoga teacher, be it a physiotherapist. But you should not embark on doing your own exercises by just looking at YouTube or looking at some of the video clips. I think you're not audible, madam.
I'm unmuted though.
What role can physiotherapists play in schools and workplaces?
This is a very important issue. See, we are now working in women's health, basically lactation, I can just tell you. So, in lactating women, we observe that majority of the women complain of backache, and there we notice that your bad posture, breast. So this not only starts at this mid-level age, but it starts right from the school, like how you're sitting in your class, how you're forward bending. These are the basic principles that you should take care of right from childhood. So I feel is that just like we speak about ergonomics and office, and we're very particular about what is the level of the computer screen or your chair height. So these are some simple issues that you should take care. And I think even in schools, where now the government of India is very proactive in ensuring that there is some unit where the health of the children is also taken into consideration, just like they have dental health checkups and general health checkups, vaccination checkups and all. They should also inculcate this habit of correct posture and taking care of your health right from school until even in office. So I think these practices should be strongly advocated. And I also feel is that whenever you are having these type of hospitals, physiotherapy should not be kept aside. It should be inculcated, should include physiotherapy. Because if you today you ask me, 70 to 80% of the population, if you see a screen out men and women beyond 50 years of age, 70 to 80% of them have musculoskeletal health issues, and these are preventable. So I think if with proper nutrition and with proper physiotherapy, you can have a better quality of life.
Um, just a sec, ma'am. I think your video was frozen in between. Your network is proper?
Yeah, I think.
Mm.
Some network glitch.
Okay, now it's
Because I
proper.
kept
Thank you.
Madam on spotlight, but in between, because of network, I think her video was not visible for some time,
Okay,
Oh, okay.
just for a brief time.
That's okay.
that's fine. Take it, ma'am. Next question, ma'am.
Yeah.
So, ma'am, what has been your biggest challenge while conducting camps or outreach programs?
Uh, our biggest challenge is whenever we talk about preventive healthcare, people don't have time. And when we talk about physiotherapy, people feel that it is just your exercise, do lift your hand. There is still we need to create more awareness about the importance of physiotherapy and what physiotherapy is. It's not just only exercise. It means a lot about it is the health of the muscles and the joints and the tendons. So this is what we need to inculcate among the community so that they are proactive and they understand it better rather than they take short steps or take very short remedial measures. So I think if we have any of these elderly women's clinic, if you have a physiotherapist attached to them, then it will make a much better impact on their quality of life and their understanding. And in our day-to-day life also, if you really think about it, the way we sit, right from the way we bend forward also, we are having several, we are giving a lot of insults to our body. So I think there is a lot of preventable healthcare that we can take care of. That is the first thing. And second thing is that if there are any health issues related to your neck, or now we are having a new breed of cervical spondylosis, which is coming up because of excessive use of your mobiles. So this is not only for the elderly, but it is right from children, how they should use electronic gadgets and to what extent they should use. So all elderly, even adults, to take care of it. And I think first is education to the community. Second is educate them on to small tips on how you can use physiotherapy in your day-to-day life. And third is when there is any issue related to your health, be it osteoarthritis or be it let us put it on a little broad spectrum, like is if you get operated for your knees and you have a TCAR, people feel that the operation itself will take care. But I would like to beg to differ here that the physiotherapy post TKR is going to be the most important aspect and which is going to decide on to the success of your operation. So I would urge people that if you are going to under the knife, you should be mentally prepared beforehand that you should start on with your exercises, because this is going to improve the outcome of your operations also. So these are some of the challenges. The acceptance for exercises is very poor in the community. We need to proactively educate our community, and this can make a bigger change in the health of the women, I would say so. And live for yourself, at least should be driven to these women. If
Yes,
you are
ma'am,
healthy,
exactly.
you can take care of your family.
Okay, so ma'am, what has been your most rewarding moment during this community service?
There have been several rewarding moments, to be factful about it. First of all, it took a long time for us to break the ice. That is to make women understand that yoga is not going to be the only answer, but you have to do yoga in the right, with the right spirit. So we
Yeah.
had in our project on yoga for osteoporosis, we had developed a manual where we included certain yoga asanas under the physiotherapy basic principles, using basic physiotherapy principles, and we educated patients on to how you can improve your musculoskeletal health. And patients which are having low backaches and cervical spondylosis, where even without medicines you can be cured. And this itself is a good message in the community that you should not just go for analgesics. You should first try to heal your muscles, heal your tendons, give time, give rest, and give supportive measures like ice packs or gel packs, which are needed. And these should be followed up intensely. So when my patients come up with telling me that they did not need to take any medicines and they took care of themselves by physiotherapy, it becomes a good feel that at least the patients are now understanding the importance of exercise, physiotherapy. So that is very rewarding rather than just blindly going after medicines.
Okay. The wonderful. So, ma'am, if you had the power to change one thing in community healthcare for women, what would that be?
See, in community healthcare, we have several camps like, hypertension, diabetes, but nobody speaks about musculoskeletal health. And the musculoskeletal health is one of the major issues that will be affecting women and elderly men and women. Because if you keep your muscles strong, you are going to have a good quality of life. And people feel that after 60, their muscles are not going to help them. But this is a misnomer. If you do regular physical exercises, if you have high protein intake, take appropriate calcium, have good sunlight exposure, and use your legs. That is, use the number 11 bus, which every god has given, which we have blessed to have with us. So I think that can bring about a major change in your life. And that is what we need to educate the community on.
Wonderful, ma'am. Thank you so much. I think we've finished
Thank
all
you
the
so
questions.
much.
Yeah.
Yeah.
Yeah, thank you so much, ma'am. And these are
Yeah, I hope
wonderful
it was
insights.
useful.
And coming from a community health expert like yourself, where you are telling us about the importance of physiotherapy in community health, that is so much valuable for us as physiotherapists. And thank you so much for all the leadership insights, and your words truly matter us, and we will strive to uh, excellence more on this. And our heartfelt thanks to Dr. Ruchi Vachne, ma'am, and Dr. Pooja Kamble, ma'am, for the wonderful platform and the constant support that they give us from the national level and the state level. And a special appreciation to Dr. Suvarna Ganvir, ma'am, and the Maharashtra IAP WC team for their guidance. And also thank Dr. Sanjeev Jha, sir. And lastly, a great vote of thanks to my team, which is here interviewing you. And ma'am, so much thank you for your valuable insights and words. Thank you so
Thank
much,
you
ma'am.
so much. Thank you so much for inviting me and having me here. And it is one of the best moments, I would say, that when you work in the community and somebody recognizes the importance of it and realizes that you're in the right path, then it is most rewarding to us also. Thank you so much.
Thank you so much, ma'am, and happy Women's Day, ma'am.
Wish you the same and wish you all the. We should, I think, wish the men also happy Men's Day because they feel so
Yeah,
sidelined during the
yeah.
International Women's Day.
They have their men's day.
They have other 364 days.
Yeah. Yes, ma'am.
Can we just have a
Thank
photo?
you.
Just
Yeah.
a second, please.
Yeah.
Yes. Thank you so much.